Good morning, good afternoon, good evening po sa inyong lahat. Welcome to the 104th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Maraming salamat po and thank you for being part of our credible online community. And to all those who have just discovered us for today, welcome po. At sana po masiyahan po kayo for our topic today. I think it's a topic that's very close to the heart of many of our regular attendees and also our audience po, kung sino man po ang sumusubaybay. At sana po for our succeeding webinars, you'll also be able to enjoy that. So, bilang po mga Pilipino and part of our culture, marami po tayong mga miyembro ng pamilya na medyo nasa senior citizen or medyo may katandaan na po na part po ng ating household. Filipino families have been very, shall we say, protective of their seniors, especially during the pandemic. They have been high risk po for COVID-19 infection. Marami po yung nagkaroon po ng, let's say, mga komplikasyon. Dala po ng kanilang mga chronic or long-standing na mga sakit. Pwede rin po dahil po sa COVID. And then prolonged hospital stays and even death, naging ano rin po yun, resulta ng lahat na yon. And for those who have survived the pandemic, there have been multiple obstacles patungkol sa how they receive their routine care, especially for those with chronic conditions, and how they avail of certain services, and how they experience po their pre-pandemic joys, if you will, yung kanilang mga hobbies, gardening, panonood ng sine, maglalakad lang sa labas, ganun po, no? And availing of the vaccination, obviously. And many families sometimes masyado pong nadala ng takot for their seniors po na they asked to stay inside their rooms, not even allowed to leave the house even when the environment was a little bit safer. And so the mental health impact of the lockdowns, still ongoing po ang pag-aaral empirically, but this has been accompanied by deconditioning, which is due to the inability to walk around, meet friends, visit their favorite places. The title for our webinar for today is Demensya sa panahon ng pandemya. Sana po marami po kayong matutunan from our expert panel of speakers. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Fridays. I always look forward to Fridays po, no? At na-miss po natin siya last week. And she is our adjunct research faculty and the President's Special Envoy for Global Health Initiatives. Kami pa rin po ay nakikiramay sa inyong loss. Here is Dr. Susie Pinado Mercado.
Thank you very much, Raymond. Good afternoon po sa inyong lahat. And before I start, I just want to thank everyone who sent their kind words, their prayers, their condolences on the chat. And even today, napakahirap pong mawalan ng isang ina. And I must say that your kind words have been very comforting to me and the support of TVUP and the whole team. So maraming salamat po sa inyo lahat. So good afternoon, everyone, wherever you are. Raymond, I got some text messages na hindi daw sila makapasok sa Zoom.
Okay. Is it
so let's just see.
Passcode problem? Sige, we'll investigate.
Parang a couple are saying that it's been difficult to get into Zoom. So I said, just go to Facebook or YouTube. So I'd like to greet everyone who's on Facebook and YouTube. And for those of you who are watching on the playback, we're here because of you. Nandito po kami to give you the best speakers we can get. And indeed, we do have the best speakers today to talk about demensya sa panahon ng pandemya. Ito siguro binabaliwala ng iba, no? Pero kung kayo po ay may mga magulang, mga lola at lolo, nakikita po natin, ako nakita ko to in my own mother, na napakahirap ng lockdown para sa kanila. Kasi sa halip na yung konting tuwa nila na makalabas sila, ay nawala na yon, ano? So pag-usapan natin yon kung paano tayong makakatulong, tsaka paano tayong makakatulong doon sa mga nag-aalaga, sa mga may edad, no? Kasi syempre hindi natin hindi natin maiiwasan minsan ang mga nag-aalaga din po ng mga may edad ay nagkakaroon din sila ng burnout. Napapagod din sila, lalo na yung mga frontliners. So ito po mga pag-uusapan natin sa araw na ito. You've noticed, no, na yung COVID sa atin ay hindi na ibig sabihin COVID-19 lang. So yung C, continuing COVID. So we are continue monitor COVID. O is other outbreaks. So pag-uusapan natin yan. Mga viruses, V, infections, I, and disasters, D. So COVID pa rin, stop COVID deaths pa rin po, pero expanded po yung pag-uusapan natin. So stay with us. We've got great speakers for you. You've heard them before. Pero napakahusay talaga nila na hindi namin mapigilan na hindi namin sila ibabalik sa inyo. And I know you're going to enjoy their brief talks. So we know na you also want to know the latest news, no? I think isa sa mga problema natin dito sa pandemya, yung misinformation, disinformation, fake news, false news. So dito po sa Stop COVID Deaths, meron po kaming pinipiling 2 balita na inihahayag namin tuwing Biyernes para updated po kayo sa mga nangyayari here and abroad. So this section is called the news update.
Maraming salamat po, Dr. Susie. And part of what we're doing is providing this news to everyone. The first of which is that pinag-aaralan na po ng World Health Organization ang monkeypox. Diba? Meron po tayong kaso ng monkeypox. Pero talagang sa mga non-endemic countries po, no, dumami na po siya. There are more than 1,700 cases sa mga bansa na hindi naman talaga dapat nakakakita or nakakaranas po ng monkeypox. In the United States, there are 65 confirmed or suspected cases in 17 states and the District of Columbia according to the CDC. So dahil po sa highly unusual nature ng outbreak na ito, magko-convene po ang WHO ng Emergency Committee under the International Health Regulations next week po, sa susunod po na linggo, to be able to determine if kailangan na po siyang ideklara bilang isang public health emergency. Matatandaan nyo po, no? Ang COVID-19 po ay ganyan din po na nagsimula. So hopefully it will not be so devastating as COVID-19, ito pong monkeypox na outbreak. For our second news item, the United States Food and Drug Administration, yung kanila pong mga advisors, they have overwhelmingly approved the use of the Moderna vaccine for ages 6 to 17 po. So matatandaan nyo po, no, kung nasamaan nyo po yung inyong mga apo, pamangkin, mga anak na bata po, no, nung nagpabakuna po sila, lalo na po yung 5 to 11, Pfizer lang po ang inaalaw na mabigyan. So hopefully with this one, this gets approved in national regulatory agency po such as the US FDA, that which has one of the strictest regulations, and then hopefully that's also something that we could adopt as policy. So it will affect procurement and the administration. Meron na rin po tayong karagdagang bakuna na maibibigay po para sa ating pediatric population. And those are our news items for this week.
Thank you very much. We're going to keep you posted on the news and on new developments every week when we meet with you on Fridays. Kasi nga, mabilis ang mga pangyayari, no? So mabuti nang nauunan tayo and we'll continue to bring the news to you. So today we will talk about dementia sa panahon ng pandemya. And I was telling Raymond earlier that I couldn't find the numbers, no, on how many people actually have dementia in the Philippines, but I guess our speakers will have that. And it's estimated that about about 10 million Filipinos are considered seniors, o mga senior citizen. Pero dumadami po mga senior citizen. Dadating din ako doon, Raymond, sa balang panahon, di ba? So, this is expected to double. Raymond, ba't hindi ka natatawa? It is expected to double.
Tawa nga ako sabi ko, akala ko iniisip ko, doon ba doon sa part na may dementia o doon sa senior? So, hindi ko
Ano nga sabi mo? Okay. So 240 by 2040, mukhang magdo-double ang population natin ng seniors at marami po ron nagkakaroon ng signs and symptoms of dementia. Hindi po nalalaman ng pamilya, hindi rin po nalalaman ng mga health workers at hindi po tayo makapagbigay ng maayos na abiso. No, kung paano, how do we manage this growing number of seniors as well as the growing number of individuals with dementia. So on this webinar, we're going to talk about that. We're going to talk about families. We're going to talk about caregivers and frontliners in relation to dementia. And we are just very happy that you are with us today. So Raymond, let's get started with our persons on the street. Ikaw na mag-cue.
Thank you, Dr. Susie. And for all those who are joining us for the very first time, we usually set our discussion into context by taking the pulse of the common folks on the street. Interviews are done po by the production team and put into a short video that is coupled up by TVUP. So maraming salamat po to our TVUP teammates. Ang katanungan na itanong po namin sa common person is, ano ang epekto ng pandemya sa pasyente ninyong may demensya? Ano ang epekto sa inyo nitong panahon ng pandemya habang nag-aalaga ng taong may demensya? Please watch this.
Pre-pandemic, malakas pa nanay ko eh. Kahit yung memory niya malakas eh. Kasi nakapag-sudoku siya, yung mga brain exercises. Nakapag-sudoku, crossword, magmamadyong, kaya active yung brain niya pre-COVID.
Hindi po siya makakalabas. Hindi po siya makakalabass, magpa-araw. Unlike sa normal days na ginagawa niya before pandemic.
Sa amin po, walang epekto sa pag-aalaga kay Lola since hindi naman kailangan magpaliwanag kung ano nangyayari sa labas bago mag-pandemic. Stay at home na lang talaga siya.
Dati, lumalabas po siya, sinasama po siya ng anak niya, kung saan magpunta, mga kaibigan niya. Niyayaya po siyang lumabas, kumain sa labas.
Pero nung nagka-pandemya na, na-stuck siya rito sa bahay, sa kwarto. Wala siyang ginawa kundi matulog, kumain, manood ng TV, konting basa-basa. Kaya medyo siguro na-depressed na rin dahil hindi siya makalabas. Ayaw namin siyang palabasin.
Wala pong epekto since same routine kami before. Yung sa tingin namin na makakapag-stress sa kanya, di namin ginagawa o ikinikwento sa kanya.
Ang epekto sa kanya, sa nanay ko, talagang very depressed. Hindi na siya yung katulad ng dati, nakikipagbiroan pa sa amin, nakikipag-usap sa mga apo niya. Ayun. Ngayon hindi, nung pandemya, nakakulong na lang siya, nanonood ng TV. Lalabas lang pagkakain, maliligo. Yun.
Kailangan lang po natin ng konting pasensya. Kasi hindi po madaling mag-alaga ng ganoong pong sakit. Kailangan po may patient po kayo mag-alaga. At kailangan din po kayong makinig kung anong sasabihin niya ng pasyente sa inyo.
Nahihirapan pero tuloy lang kasi wala naman siyang ibang aasahan kundi kami. Kaya yun, mahirap talaga mag-alaga ng taong may demensya, lalo na kung mahal mo sa buhay katulad ng nanay mo.
Thank you very much, TVUP. It's always great to hear what ordinary people are thinking, and just reflecting on my late mother. She was always complaining na nakakulong siya. No? And it's hard because you want your parent or your grandparent to be safe. So ayaw mong naglalabas, diba? At the same time, gusto mo rin na makaranas sila nung tuwa. So it's a dilemma. It's a dilemma for everyone, and really great to hear from TVUP some of our views from ordinary people. Raymond, over to you.
Thank you so much, TVUP, for that, well, it's emotional po, no, na short video. So maraming salamat for taking the time to put that together. Thank you also, Dr. Susie. But right now, a little bit of housekeeping for all those who are asking. Certificates of attendance have been given po, no, for those who attended webinars 1 to 102. Complete na po iyon. So if you have watched at least 50% of the webinar duration, you should have received your certificate of attendance. Meron pa pong konti na humahabol para po sa episode 103 po natin. And to those na nagtatanong po ba't hindi po sila naka-receive, our team is constantly monitoring our email inbox po, no? So please put them in and send them in po via stopcovids@up.edu.ph. For today's webinar, we will be having a standard panel discussion format, and then after our speakers have presented, we will have a Q&A session wherein we will entertain questions from our Zoom, and then those who are in Facebook and in YouTube. So kung kayo po ay mapili, at least in the Zoom, na maybe you could open up your videos and then ask your questions live to our panel of expert speakers. Sana po paunlakan nyo po kami at makatanong po kayo sa ating mga speakers. But before we delve into the webinar, we'll go into the fun quiz, no? Dr. Susie.
Go ahead.
So, we have ano po, no? Our usual animated po na introduction video. TVUP.
Hello!
Kumusta na kayong lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Thank you so much, TVUP. So again, we have 2 questions po, no? Can we have it on the Zoom in addition po to Slido? Ito, okay. Thank you so much. Before I forget, those who are joining us via Facebook or YouTube, please open up your internet browsers, type in slido.com, and when you're prompted, enter the code 5405717. That's 5405717. For our first question, alin sa mga sumusunod ang mga maaaring gawin para maiwasan ang demensya? Option 1, iwasan ang maaalat na pagkain. Option 2, huwag manigarilyo. Option 3, mag-ehersisyo. So, to exercise, And then, last option po natin is all of the above. Maraming salamat po sa mga nag-greet sa atin kung nasaan man po kayo dito po sa ating Zoom chat. We'll also like to greet those who are joining us from the Baguio Doctors Medical Laboratories in Benguet, from Makati City, LGU po from Makati, from the Gubat Street Anthony Cooperative Diagnostic Center in Sorsogon, the West Visayas State University Medical Center in Iloilo, Dept Health and Nutrition Unit sa Region 8 po, Eastern Visayas, and the Philippine Coast Guard Medical Service in Misamis Oriental. Para po sa ating pangalawang katanungan, alin sa mga sumusunod ang mga sintomas ng burnout? So, option A, sumusungit o madaling magalit. Option B, padalos-dalos ang desisyon. Option C, madaling mapagod. Option D, kapabayaan. And option E, all of the above. So we are seeing answers coming in from half of our attendees po. No? Sana po mas marami pa po ang sumagot ng ating questions that we are seeing on the screen. We'd also like to greet those who are joining us internationally or from abroad, from the Chonin Hospital in Taipei, Taiwan, Nguyen Thai Hoc Polyclinics in Vietnam, from Mentari Intercultural School in Jakarta, Indonesia, those from Saudi Arabia, specifically from University of Hail and Qasim University, Geras International School from Doha, Qatar, Lunichi Ali University of Blida II in Algeria, Penn Medicine Princeton Health in Plainsboro in New Jersey, Winston-Salem, North Carolina in United States, Philippine Nurses Association from Edmonton, Alberta, Canada, and St. Augustine's Catholic Primary School, Tonbridge, Wales, in England. So yun po, maraming salamat po sa inyong lahat. We will not be closing this fun quiz po as of yet. At alam ko, marami po ang mga gusto pong sumali. And our speakers will comment on the answers po later on during the panel discussion. And to get the ball rolling, Dr. Susie will introduce our first speaker.
Yeah, thank you very much. Thank you very much, Raymond. Okay, thank you very much, Raymond. I think I really like the fun quiz kasi parang somehow, di ba, after 1.5, 2 hours nakikinig, parang ano nga ba natutunan natin? Di ba? So ito ngayon, dalawa yung main, di ba? Parang paano makakaiwas sa dementia at saka ano ang signs and symptoms ng burnout sa caregiver. So hindi lang tungkol sa mga may dementia, pero tungkol din po sa mga nag-aalaga. Kasi pagka minsan nakita niyo mga pasyente, ang nagsasalita na yung caregiver, di ba? Kasi hindi na makapagsalita yung pasyente. So magandang ating mga discussions today, and our questions came from our two very excellent guests. We bring you only the best, and every time we speak about older persons and senior citizens, isa lang naman po ang takbuhan namin, no? Ang ating pong isa sa pinakakilalang gerontologist sa buong bansa. Siya po ay siyang director of the Institute of Aging of the National Institutes of Health of the University of the Philippines in Manila, and really very compassionate doctor pagdating dun sa mga may edad. Napakahusay po niyang makinig at talagang naiintindihan talaga niya ang mga may edad. So we'd like to welcome to the webinar for the 4th time. Meron na yatang meron ng award. Dahil pagka pinag-usapan natin, senior, ito talagang takbuhan natin. Napakalinaw po magsalita. Dr. SHELLEY de la Vega. Shell, welcome to the webinar.
Salamat ulit lagi sa TVUP, kay Doc Susie, na classmate ko yan, kaya yan mabait sa akin. Doc Sarmiento, of course, co-director.
Thank you, Director SHELLEY. Thank you, ma'am.
Of course, sa lahat ng taga-TVUP.
Go ahead, Shell.
Alright, so maraming salamat. Nakinig ako mabuti dun sa dun sa mga man on the street. Talagang nakita ko naman ang hirap ng kanilang dinadanas, sa pag-aalaga ng kanilang mahal sa buhay. So, natin ito.
Sige, go ahead, Shell.
Okay, so ano ba yung mga salitang naririnig natin pagka tayo...
Shell, wala pa. Ayan na. Okay,
there it is.
Okay, you're on.
Dali lang po parang mali yan eh.
Ang ganda! Ang ganda! Kasama
Ang ganda.
Slide! Oh,
You use the slide as your background. Very good.
ang ganda!
Sandali
Dapat
lang, hindi ko
magganyan.
na ipakita eh. Sorry po.
Ay, galing mo, Shell.
Ano
Maganda
magaling?
yun.
Maganda naman talaga siya.
Oo, sige. Ulit.
Ulit na lang tayo. Pero nakinig akong mabuti sa mga sinasabi nila na na hirapan sila, lalo na kung mahal mo sa buhay kasi, di ba? Mahal mo sa buhay ang taong inaalagaan mo. Hindi madali eh. Yung isang nagsalita doon ay parang ang kinuwento niya ay okay, nasaan ba tayo?
Yan.
Ito.
Yan.
If you can go to presentation mode, ma'am.
Yun na lang.
Slideshow.
Presenter view. Ayan na ba?
Yeah.
Ayun.
Okay, go ahead.
Salamat po. So nakikinig ako sa mga sinasabi nila eh. Talagang mahal nila sa buhay. Kaya mahirap talaga mag-alaga ng taong may dementia. Kahit na ikaw ay isang professional, I think one of the speakers there that you interviewed was a professional because she said, pasyente, di ba? Ang sakit na dementia. Na tama naman kasi ang dementia po ay isang sakit. So ako po ay walang conflict of interest. Ayan po ang aking declaration. And for this talk, no? Pag-uusapan natin ang demensya, ano ba 'yon? Kasi ang naririnig nating salita ay makakalimutin, ulyanin, senile, di ba? Sa mga Ilocano, agkabaw. So these are terms that we use when describing someone with dementia. And today we are going to discuss what is dementia. And I will present some local data on mental health based on our Fit for Frail study. We will also talk about dementia risks in COVID. And I will present the convergence between COVID and healthy aging kasi tayo po ay decade of healthy aging na din. And then I will give some pointers on caring for persons with dementia in the time of COVID and share also some multimedia resources from our Institute on Aging NIH project funded by the WHO. All right, so mag-umpisa na po tayo. Ano pa ang dementia? No? Now, dementia is really a disease. No? Hindi po siya part of normal aging. And dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia, yung dementia coming from small strokes in the brain, are two of the most common types of dementia. So kung kayo po ay parang makakalimutin lang, or nakakalimutan nyo sa nilagay ang ballpen, ang salamin, ganyan, or kung minsan nalilito, lalo na sa COVID, nung na-lockdown tayo, hindi na natin alam kung minsan ang petsa, no? Kung yun lang naman, hindi naman po yun dementia. It really has to interfere with your ability to take care of yourself so that people with dementia eventually need help in feeding, bathing, dressing, going to the toilet. Yun po ang dementia. Ano po? So let me present to you some local data on mental health among Filipino older persons from our Fit for Frail study, which we completed in 2019. And in that Fit for Frail research, we looked at 405 participants from 4 barangays representing the NCR, regions 4, 7, and 11. And we did a comprehensive geriatric assessment po ang tawag namin, plus the Montreal Cognitive Assessment Tool, which is a tool used to screen for dementia. And then we had a geriatrician, and the geriatrician finally made that diagnosis, dementia po ito. No? So based on their MoCA score, majority had mild cognitive impairment. Ano ba yon? Hindi naman porque may mild cognitive impairment ka ay magkakadementia ka na. Pero ito yung medyo, may mga parte ng test nila na hindi nila masyadong nagampan ng mabuti, lalo na kung wari sa language, yung may konting nalilimutan ng mga salita, pero hindi naman necessarily magkakadementia sila. But majority had mild cognitive impairment. We also found out that dementia and depression were more prevalent among females. Diba yung nagkwento kanina sa atin, na-depress masyado ang nanay niya na may dementia. At mas prone talaga ang mga females sa dementia habang tumatanda. No? And then also, more participants reported symptoms than were diagnosed by study physicians to have mental health problems. Anong ibig sabihin nun? Madaming nagre-report, hindi naman pala. So, kunyari, dito sa slide na ito, madaming nagsabi, oy, may problema ako sa pagtulog ko, hindi ako makatulog. Pero actually, out of the 51.9% who said may problema ako sa pagtulog, 29 or almost 30% lang naman ang talagang may sleep disorder. Ngayon, itong nakakapagtaka, walang nagsabi na baka meron silang cognitive impairment eh. Pero base sa aming MoCA test, 24.4% had a risk for cognitive impairment, and 30% ng aming participant ang nagsabi meron akong nararamdaman na parang depression ang symptoms. Pero 20%, medyo madami-dami din yun, 20% halos ang talagang may depression na talagang kailangan na magpatingin sa doktor. Okay. So in this slide naman, we find that many reported symptoms that they refer to as dementia. So marami nagsabi na may symptoms na ako ng dementia. So 51%. Pero nung sinuri silang mabuti ng aming team, 9.1% lang naman pala ang talagang may dementia, and of those 3.2% were Alzheimer's disease. Now sa isang pag-aaral na ginawa sa Marikina, ang nakita nilang prevalence doon ay 11%. Pero ibang klaseng pag-aaral at ibang populasyon naman yon, pero hindi naman nagkakalayo. So tingnan natin itong anxiety. 25.9% had anxiety symptoms, and 7.7% of them had diagnosed anxiety disorder. So alamin natin mabuti ang ating kondisyon ng ating mga senior citizens sa labas. Mukhang madaming underreporting, di ba? Kasi hindi naman sila nakakapagpatingin sa specialista talaga sa mga kondisyon na ito. So, is dementia a risk for severe COVID, or does COVID confer a risk for dementia? So, yun ang ating sasagutin na ngayon. No? So, our colleague in the Department of Neurology of UP-PGH, Dr. Anlacan, and her team of neurologists did a sub-analysis of the Philippine Corona Study. Now, itong Philippine Corona Study na ito, isang malaking pag-aaral, multi-center, retrospective cohort of 10,881 participants who were admitted for COVID all throughout the country between February and December of 2020. So, nag-subgroup analysis sila. Tinignan nila yung matatanda at yung mga may dementia sa grupo na yon. So in that dementia subgroup analysis, they described the finding that the adjusted hazards ratio, ang hazards ratio kasi yung parang risk, the risk of persons with dementia versus without dementia are both higher for COVID mortality. So there was a 7.25 increase in risk for COVID mortality if they had dementia. And there was also a higher risk for ICU admission, 4.37, a higher risk for those with dementia compared to those without dementia. So clearly, this study shows that if you are a person with dementia who were hospitalized for COVID, the mortality is higher and the ICU admission is higher. Now, the other question naman, nakaka-dementia ba ang COVID? Yan ang isa nating tanong, Now, naririnig na natin ito yung long COVID, di ba? Yung long COVID, ito yung matagal ka na-discharge ka na sa ospital, tapos na yung simptomas mo ng lagnat, ubo, etc. Pero parang may nararamdaman pa rin, So we have also heard that long COVID, both psychological and physical symptoms, may persist many months after a patient has supposedly recovered from the infection. And I have had several patients consulting me in my clinic for what they say or describe as brain fog or poor memory. Parang nakakalimutin na ako. Nabanggit din niya nung ating man on the street, di ba? And there are other symptoms of long COVID, grief, of course, and bereavement, post-traumatic stress disorder, insomnia, anxiety, and of course, physical symptoms. Lagi pa rin silang pagod, may masasakit pa rin sa kanilang katawan, Pero let's talk about poor memory. What is the risk of dementia after COVID? Now, in this systematic review by Gordon, etc., in the Alzheimer's Dementia Journal, which is available online for free, we know now that COVID may increase cognitive impairment. It can, But does that mean dementia? Not necessarily. Kasi like I said earlier today, hindi naman porke nakakalimot ka ay dementia na yon. Meron kang maaaring nakakalimutan, pero hindi naman necessary dementia kung hindi naapektuhan ang pang-araw-araw mong paggawa sa sarili. Okay? But it can possibly accelerate the diagnosis of dementia after a COVID infection. And the question is, pag ikaw pa ay may dementia tapos nagka-COVID, mas mabilis bang lumala? Hindi pa natin alam. Yun po ang sagot doon, Hindi pa natin alam because there are a lot of research gaps, So there are multiple means by which COVID-19 may lead to brain dysfunction. First is the direct brain infection by the virus. So the virus can cause encephalitis, di ba? Second is the vascular inflammation. Yung mga blood vessels become inflamed and the pathological changes of these blood vessels in the brain together with systemic coagulopathy. So nagkakabara-bara talaga. And this is the same thing that happens in mini strokes. In fact, in COVID, we realized that there were a lot of strokes, among persons with severe COVID. So pag nagkaroon ng ganon, maaari ka nga talagang magkaroon ng dementia. Third is the severe inflammation, or cytokine storm. Di ba? We heard about that cytokine storm. Grabe yun, di ba? Which can cause damage to the neurons or brain cells. And COVID itself may also trigger an autoimmune disease so that the body fights its own brain cells and nerves, such as what happens in the Guillain-Barré syndrome, yung nagkakaroon ng parang paralysis na umaakyat. So finally, there also can be multiple organ dysfunction kasi apektado ang puso mo, ang kidney mo, ang lungs mo, no? Ang buong katawan mo. So definitely pag sobrang dami ng naging sakit mo, makaka-cause yan ng confusion, no? In persons with COVID and dementia, when they get severe COVID, they can have acute confusion, yung tinatawag na delirium. Talagang kuminsan nagwawala sila, hindi nila alam kung nasaan sila. Hindi naman sila ganun dati. May dementia naman, pero hindi naman nagwawala. Pero delirium or acute confusion, no, can happen in severe COVID. And that can persist, yung delirium na yon, can persist for months. And that can be actually what we are seeing now as long COVID, not necessarily dementia. Okay. Now we can agree, di ba? Agree na tayo, na-present ko na yung some data that persons with dementia are at risk and are at a higher risk of COVID complications. Aside from the proposed pathophysiological causes, those of us who take care of people with dementia are aware of the communication and cognitive barriers that lead to their difficulty in understanding the risks of leaving the house, especially during the earlier lockdown. Kaya may narinig ako, parang kinulong yata di ba? Pero hindi lang naman yun Talagang may mga pasyente ako na talagang hindi nila pinalabas sa kwarto yung matanda, kakaawa naman. Pero syempre sa takot lang nung mga unang panahon ng COVID, nung wala pang bakuna, no? And then of course, difficulty in following minimum public health standards such as wearing a face mask. Hindi nila maintindihan, tinatanggal nila. No? Hindi mo sila masabihan na maghugas ng kamay, gano'n. And when they do have COVID, the risk of delirium or acute confusion due to illness. And these are some of the, problems that we have encountered as caregivers and family members of those with dementia. Now, with the easing of alert levels, kasi alert level 1 na lang tayo we need to rethink lahat ng mga ginawa natin. Kasi nga, kuminsan nakakasama yung ating ginawang isolation, di ba? We need to rethink our imposed isolation that increases behavior and psychological symptoms such as fear, anxiety, and depression. Talaga naman, wala na silang makausap, hindi na nila magawa yung dati nilang gustong-gustong gawin at mga taong gustong-gusto nilang makausap, na wala yun So talagang apektado ang kanilang mood, no? Cognition then is also affected. So convergence. So now let's go to healthy aging kasi gaya ng binanggit ko kanina, tayo ay nasa decade of healthy aging. Ano ba 'yun? No? Now healthy aging is defined as the process of developing and maintaining the functional ability that enables well-being in older age. Ito yung sinasabi ko, doing something that is meaningful to them or to you, no? We accumulate strengths and deficits across the life course. That is the natural intrinsic capacity that we have, di ba? Based on our genes, ano ba yung mga sakit na naranasan natin, ano ba yung mga aksidente, yung pandemic, di ba? Lahat yan ay affected ng ating intrinsic capacity to age and reduce in function as we age. Now, however, despite accumulating deficits across the life course, if we have a very supportive environment, we can remain functional for as long as possible. Yun ang sinasabi ng healthy aging. No? Functional ability is doing what is meaningful to you despite illness and disability. And it depends on the interaction between our intrinsic capacity to age and lose function and a supportive environment. So, if we look at this, ito na-realize ko habang maswerte ako kasi may mga project ko sa dementia, may project ko sa healthy aging, at saka sa bilang internist po, syempre yung ating mga prevention ng mga sakit, no, ng mga nakakadulot ng komplikasyon ng COVID. Remember when they were reporting the deaths from COVID, we were saying, wow, the people dying from COVID are actually the ones who have non-communicable diseases. Ito yung may hypertension, severe lung disease, no, or COPD. Sila yung obese, di ba? Sila yung mataas ang blood sugar or may diabetes. So these are the things that hamper health, no, of adults. So that now, if we look at this slide, no, there is a convergence that we see. Because what we see here is that if we minimize diabetes, treat hypertension, stop smoking, and reduce obesity, we not only reduce COVID complications, but we also protect our brain from dementia. No? Diba? Yan ang nakikita natin eh. We can further prevent dementia through an environment that supports healthy aging. And that is, of course, aside from a good health system, reducing air pollution, preventing and treating hearing impairment, maintaining frequent social contact, and continuous learning and education. So ito yung very important eh. Kaya importante na hindi na natin sila i-isolate, lalong lalala talaga, no, ang kanilang dementia. Okay, so how do we care for persons with dementia in the time of COVID? I'm going to share some resources developed by the Institute on Aging NIH with funding support from WHO Pro Mental Health Unit. Okay, so this really is going to come from the Dementia Toolkit. No? There is an English version. The original is an English version, which we were allowed to translate into Filipino. And of course, our COVID Dementia series, which is available on YouTube. Okay? So may mga links po dyan. You can go to the links. I am going to share you some of the content. So this is the Dementia Filipino Toolkit, or gabay na tutulong sa komunidad sa pag-asikaso at pangangalaga sa mga may dementia. So, ito ay karagdagang kaalaman sa MHGAP. Meron kasing dinevelop ang WHO at ang DOH na Mental Health Global Action Plan. No? Mga guide ito, paano mag-alaga ng may dementia, may depression, may addiction, etc. So ito ay karagdagang kaalaman para sa mga primary healthcare professionals sa community. Pero kung kayo po ay nagtatrabaho or kapamilya sa komunidad na nakapagtapos ng sekundaryong pag-aaral o pataas, no, itong high school, ito ay maaaring gamitin ninyo. Ito po ay available for free at nasa webpage na po namin ito. So basahin po ninyo ito sapagkat isa sa mga chapter dito na napaka-importanting basahin ay tungkol sa suporta sa mga taong may demensya na naninirahan sa pamayanan sa panahon ng COVID. So itong mga topics na ito ay talagang para sa inyong mga nag-aalaga at para din sa mga gustong umiwas sa demensya kasi may healthy aging page po tayo dyan. No? So the toolkit is relevant for persons who are caregivers, and it talks about vaccination, no? In the community. What is the role of the community? Anong tungkulin ng komunidad para sa paggabay sa mga taong may dementia. So hindi lang kasi yung kamag-anak at hindi lang yung caregiver na hinar ninyo. Buong barangay po talaga ang kailangan magtulungan at buong Pilipinas kailangan magtulungan para sa mga taong may dementia. Yun ang ating gustong ipaalam dito sa ating Dementia Toolkit. Now, ito po ay mga specific recommendations na nakasaad sa ating toolkit. Kasi unique ay itong Filipino toolkit is unique because it has several chapters on COVID. No? So here are some specific toolkit recommendations for care of persons with dementia at home. So first of all, vaccination. Vaccination is life-saving, especially for persons with dementia. Provide a safe home environment to reduce the risk of falling. Madami po kasi sa mga may matatanda, hindi lang may dementia, dahil napakaliit na ng lugar na pinaglalakaran nila. No, lumiit na ang mga muscle nila. No, ang balance nila hindi na rin maganda. Yung iba, parang bumagal ang paggalaw nila. So those are risks for falling. So encourage mobility at home through daily walks. No? And if you can bring them outside, okay na, level 1 na tayo sa park, di ba? O sa mall, pag maaga pa lang, no? On weekdays or during opening hours in the mall. Paglalakad, madami akong pasyente, naglalakad sila papunta sa simbahan or sa palengke. Maganda po yun. No? They enjoy that. And make sure that they get their daily dose of healthy sunshine. Di ba? Iba talagang maarawan. No? Ano po? And ensure an active mind through reorientation, games, di ba? Parang narinig ko kanina may nagsosudoku or may mga pinabasang mga libro, definitely, no? Pag may dementia, maganda na enjoy nila yung mga photo album nila o kung may video ng pamilya. Reviewin po yon. Ang tawag po doon ay reminiscence therapy. And of course, socialization, very important. Family and friends can now link through FB or Facebook, Viber, and video calls But with the easing of restrictions, we can have small family gatherings as long as everyone is vaccinated and we provide good ventilation. And when you're not eating, wear a mask. No? So COVID prevention, for persons with dementia, they need reminders and cues on hand washing and face masks. Meron akong kakilala na may nakapaskel na hand washing at saka face mask na mga mini posters sa buong bahay nila para maalala ng kanilang nanay na may dementia na, oops, kailangan ko nga palang mag-hand washing. Okay? And caregiver support, no, is very essential. Nakaka-stress po talaga. And our next speaker, Dr. Sandy, will be talking about that. Okay? Now, this is about acute care because I know some of you work in hospitals. When a dementia patient is admitted to a hospital, we advise that you provide a 24-hour caregiver. No, madami kaming mga reports of patients having a fall inside the hospital during the early days of COVID, kasi binawal din namin na magkaroon ng caregiver sa loob. Di ba? Nung umpisa pa lang ang COVID, takot na takot lahat Pero now, you can provide a 24-hour caregiver inside the hospital. Watch out and manage delirium. Ito yung sinasabi kong acute confusion, no? On top of dementia. And some of the medicines that you have to watch out for that can aggravate dementia and delirium are dexamethasone, quinolones, which is a type of antibiotic, diphenhydramine, which is used for sedation or sometimes as a sleep aid. And of course, our sedative hypnotics, mga sleeping pills. No? Now, kadalasan naman talaga ang dahilan ng delirium sa isang taong may COVID na nasa ospital, na may dementia pa, ay yung sepsis or severe infection. Yun naman talaga. Pero syempre, kailangan natin bantayan yung hypoxia or kakulangan ng oxygen sa katawan at utak. Ganun din ang pain, no? And other metabolic problems. So these can all cause delirium. Now, again, we want to prevent deconditioning and falls through guided rehab and physiotherapy. So maaga pa lang, nagpipiti na, no? Kahit nasa ICU, pinipiti na kuminsan no? Nutrition support, kasi syempre nawawalan sila lalo ng ganang pagkain, no? And we always have to call the family to a multidisciplinary meeting to discuss the goals of care, no? Kasi kuminsan, ang taong may dementia, kuminsan severe dementia na yung bedridden na ng ilang taon na hindi naman nakakausap, it just so happened na nagka-COVID na dala sa ospital. Ano ba ang goal ninyo? No? Yung advanced directives, lalo na yung intubation, mechanical ventilation, yung mga CPR, dapat napag-uusapan na yan. No? Mas importante nga, hindi pa na-hospital ang isang pasyente na pag-uusapan na yan, di ba? Para hindi nakakagulantang, di ba? And discharge planning, which means, anong gagawin natin? Okay, gumaling na si nanay o si tatay, pauwi na, anong kailangan sa bahay? Para paglipat niya sa bahay ay maayos pa rin ang pag-aalaga sa kanya, tamang gamot, ang naibibigay, pagkain, etc. So yun ang discharge planning. Now, of course, there are more details that I can no longer discuss because of time limitation. So you may access more information on promoting the health of older adults living with dementia during COVID-19 by watching our webinar series on YouTube. Please share and like. Okay. Malapit na po tayo matapos. Ito lang po naman ay pinakikita ko dito sa ating slide na ito that we are now supplementing the work with a regional policy brief on dementia awareness and risk reduction in the WHO Western Pacific region. So hindi lang po nagtatapos sa pagbibigay ng kaalaman, kung hindi kailangan po kasi ng polisiya, hindi po ba, para sa taong may dementia, lalo na sa dementia awareness and risk reduction, na kagapay naman natin ang TVUP sa ating paggawa ng dementia awareness. Okay, so again, this is our webpage. Nabanggit ko na kanina that we have a healthy aging webpage. No? So dito po ay pinag-uusapan ang tungkol sa malusog na pagtanda. Dito nyo rin mahahanap yung mga resources na pinakita ko, yung toolkit. Meron din po kaming free poster cards. No? Pwede nyo i-download yan at i-print para sa inyong health center. And of course, we have some social media write-ups in LinkedIn, Facebook, and Twitter. So make sure you visit our web pages and social media accounts. Okay, gaya ng sabi ko, hindi po talaga nagtatapos sa pag-uusap lang at pagbibigay ng abiso, no? Pero kailangan talaga ng polisiya. So ang aming project po, yung Fit for Frail na pinresent ko kanina yung mga ibang mga data natin, ay naglabas din ng isang policy brief tungkol sa pagbabakuna sa matatanda. At isa po to sa mga basihan kung bakit naging A2, no, top priority ang senior citizens sa COVID vaccination. And they should still be top priority, no? Lalo na pag may dementia, make sure that there are also boosters. Pero hindi lang po COVID vaccination ang pinag-uusapan natin dito, kundi ang bakuna laban sa flu, no, na every year dapat, at bakuna laban sa pulmonya or pneumonia. Make sure na your barangay has a program for that, and natutuwa po ako kasi sa barangay namin, napaka-active po ng aming mga officials, pati po yung mga kapitbahay ko, napaka-supportive nila. Nung nagkaroon ng rollout ng bakuna ng COVID, talagang I could feel, no, how the barangay was so very important. Everyone there was so important in making sure that people got their vaccines where they were, kasi nag-home visit pa sila, no, nagpa-home visit pa sila. Ganun din, yung barangay namin ay tumulong din dito sa paggawa ng Dementia Toolkit. Nung English version pa lang, no? Yung barangay namin, hindi ko nababanggitin kasi baka ayaw nila magpabanggit. Pero alam na nila kung sino sila. Sila din ang tumulong sa pag-final ng ang contents ng toolkit na ipinresent ko sa inyo. English version and Filipino version, no? And they were also trained likewise. Okay. So, dementia in the post-COVID era really will be less of a burden, I suppose, no? If we really support healthy aging, no? And if we have a supportive environment that supports healthy aging of people with dementia. So, the community or barangay has a role, no? So people with dementia can maintain and continue to do things that are meaningful to them if the community or barangay provides social support through inclusive programs. For example, meron kayong art event, fitness class, prayer meeting. Sama nyo, kahit alam natin na may dementia, sama nyo pa rin, no? And protect them from ageism. Diba? Yung matanda na kasi yan, eh, no? Neglect and abuse, because persons with dementia are very prone to abuse and neglect. No? Be aware. No? And then, of course, continuing education skills, literacy classes. Yung iba, nag-enroll pa sa pagkanta o pag-play ng musical instrument. Maganda yon, di ba? Or paano magluto. Maganda yon, nakakatulong sa brain yan. No? And we need to allow our older people to volunteer, mentor, and visit other neighbors. No? This will also help prevent dementia, ha? Diba? Kasi socialization yan eh. And of course, the physical structure of the barangay or the community has to have accessibility features, diba? Hindi lang accessibility sa wheelchair, kundi digital access, Dr. Sarmiento. Digital access. Access issue na yan ng internet, diba? Kasi madami sa atin ang matatanda ang kailangan pag-aralan talaga paano ba mag-internet search. No? And of course, provide safe spaces to walk and be active. Kasi sabihin natin, maglakad kayo sa labas, baku-baku naman pala ang kalsada. O kaya, paglabas mo, puro tricycle na agad. So, saan nga ba dapat ang magandang paglalakaran ng matanda? No? So, isipin po natin yon. So again, we end with the public health perspective on dementia and aging, because the Philippines is increasingly becoming old. And the older a country is, the higher the number of persons with dementia. Okay? Because age is a risk factor, no, for dementia. Although dementia is a disease, no, the older we are, the higher our risk for dementia. Okay? Again, dementia is a disease. Hindi po siya part of aging. So, thank you to the UP system, UP Manila and TVUP for allowing us in the IA, Institute on Aging, to present our policy brief statements, publications on vaccination, pandemic preparedness. And we also have, by the way, some na-present ko na sa ibang TVUP yung ethics of allocation and access during the COVID surge, and of course healthy aging. So everything that I presented to you is available here in our website and our social media pages. Thank you po sa lahat. Thank you, TVUP.
Yeah, thank you so much, SHELLEY, for that excellent experience.
Kasama yun.
Hindi lang yan, may heart spotting naman yung heart.
Kami namang hearts nga pala, tumapalakpak. Salamat po.
Maganda, Shell, maganda, very clear. I think what we'll do, Raymond, is yung site nila, ilagay din natin sa opening.
Yes, healthyaging.ph. Correct.
Salamat
so,
po.
people can go to the Thank you, Shell, look at your hearts. Oh my goodness.
Oh, ang daming heart. Thank you.
Okay, thanks, Shelley. Okay, so we go to our next presenter, Raymond. Go ahead.
Thank you, Director de la Vega from the Institute of Aging. Thank you, Dr. Susie. For our second speaker, kilala nyo na rin po siya. We've had her before. And we're really privileged to have her again as one of our speakers, especially for this topic. Lalo na po, paano naman po yung mga nag-aalaga sa mga pasyente po na may, let's say, may dementia po and thereabouts. So it's my pleasure and honor po to introduce to our Zoom attendees and also our webinar attendees in YouTube and in Facebook. Our next speaker, she is the chair of the Department of Psychiatry and Behavioral Medicine at the UP College of Medicine, Philippine General Hospital. Twice na po siyang lumabas po, but we're really deeply grateful to her, Dr. Sandy de la Fuente. Dr. Sandy?
Hello.
You're on mute, ma'am. Ayun, okay. Go ahead.
Hi. Good afternoon sa lahat. So let me share my screen and get started. Oops. Okay. So ako po ay naatasang magsalita. Ang topic natin ngayon ay demensya sa panahon ng pandemya. Ang inaasahan niyo po ay tungkol sa caregiver. Pero ang approach ko po is to help the caregiver be more responsive sa kanilang inaalagaan. Ang mga nabanggit po ni Dr. SHELLEY ay yung mga basic tips. Gusto ko lang po i-reinforce some of them. When taking care of someone with dementia, important po to keep a sense of structure and familiarity. So, mas gusto po nila yung nakagawian nila. Nakakaaliw yung sabi ni Dr. SHELLEY na kung gusto mamasyal sa palengke, kasi po syempre yung mga may edad mahilig pumunta sa palengke, di ba? Not necessarily sa mall. So if that is what is familiar to them, so we keep that in mind. And then as much as possible, we involve them sa daily activities para hindi po yung nakain tulog na lang. And then we want to vary the activities to stimulate all their senses. And then yun na nga, try to spend time outdoors. Nabanggit kanina, nalulungkot kung hindi na naaarawan. Tapos yung socialization, importante. These are basic approaches to care. Pero because of COVID, na-challenge nga tayo. Because of COVID, limited ang movement, limited ang interaction. Okay, so ano ba ang target natin? We want to address the following. As caregivers, ito yung challenge. They become agitated, aggressive, minsan may psychotic symptoms, may depression, or parang walang pakialam, or paulit-ulit ang tanong, or hindi makatulog. Usually po, ang behavioral symptoms is how they're expressing an unmet need. Okay? So what we would like to do is, how do we manage behavioral and psychological symptoms through non-pharmacologic or psychosocial means? Basically po, we want to prevent distress and promote well-being doon sa person with dementia. And this is not easy kasi dementia itself is very distressing. Tayo lang po, di ba, pag may nakalimutan, nagpapanik na kung may dementia na ba ako. So imagine niyo po yung taong may demensya na unti-unting nababawasan yung naaalala nila. So ano ang goals natin in care? When we say we want to address the problems, what do we want to do? Improve food intake, improve communication, improve mood, hygiene, activity, engagement. Paano ito? Ang foundation po niyan ay understanding the person with dementia. Sabi nga nung in-interview kanina, kailangan talaga intindihin mo. Hindi po dekahon ang management. Marami pong irerekomenda, pero kailangan tingnan ninyo yung mismong inaalagaan nyo, alin ang applicable sa kanya. Tapos yung functional ability nga, sabi, we can do that by manipulating the environment so that it will be user-friendly or friendly to the person with dementia. Pati activities, ano ba ang angkop sa kanya while being mindful of safety. And last but not the least, ang caregiver, kailangan pangalagaan. So I want to share this model with you. Sabi kasi sa akin ni Doc Susie, start with a principle. At sinunod ko siya to the letter. Anong principle ito? So I found this model on competence and environmental press. Bear with me. So ang nakalagay lang dito ay assess the competence of the person at i-match mo dun sa challenge of the environment. Kapag na-match mo ito, nandun siya sa zone of maximum comfort. Kung yung environment niya, may sense of competence siya. Pag sobrang stimulating ang environment, hindi yun makakatulong. Pag sobra namang walang stimulation, hindi yun makakatulong. So we want to match the challenges in the environment to the capacity of the person with dementia. Dahil iba-iba ang capacity nila kung mild, moderate o severe na ang dementia, kailangan iangkop mo sa kanila. So sabi nga, let's understand the person, yung kabuuan niya. Kamusta na ang kanyang cognitive capacity? Ang relationships niya? Ano ba ang mga hilig niya? Ano ang nararamdaman niya? So basically, yung center circle, look at the person. Look at all of the person and understand. Okay, and then let's try to see it from the person's perspective. Ito po, in general, pag nagkakaedad, sabi nga ni Doc Susie, lahat tayo dadating rin doon. Talagang nagbabago po ang vision, pati pandinig, panlasa, pati ang sense of touch. Okay? So lahat ng senses affected as we age. How about those with dementia? Yung depth perception nila, yung kaya nga delikado sila sa fall hindi na nila ma-assess yung distance. Yung spatial orientation, yung lapit. Tapos dahil malabo na yung mata, yung kulay, medyo may difficulty judging color and contrast. So keeping this in mind, it will help us address the environment. Ang sabi ng mga studies, environmental intervention when properly done can improve functional ability, improve food intake, communication, develop meaningful relationships, hygienic practices, and mood. Sabi nga, ang behavioral problems, ito yung way nila of expressing an unmet need. So what do? We try to meet their needs through environmental manipulation. Ano ang barriers? Kung madilim, kung poor contrast in colors, or maliliit yung mga binabasa. Sabi kanina ni Doc SHELLEY, meron siyang kakilala, naglagay ng mga posters sa bahay. So we need to make those posters friendly to the intended user. So makakatulong ang wayfinding cues. Nasaan ang banyo? Nasaan ang daan? Tapos we need high contrast, large print labels. Color contrast helps distinguish different types of objects. A healthy older person requires more contrast. Okay? So, kita nyo yung mga slides ko. May contrast. So, it belies my age also. Okay. So, when you design or rearrange the environment, you want to optimize cognitive aspects. So, yung senses, dapat sakto lang ang stimulation. Enhance lighting, minimize glare. Kasi sobrang liwanag, nakakasilaw. And then, visual organization will help the person optimize cognitive organization, maximize contrast, tapos yung sightline niya importante kasi hindi na siya ganun ka-resourceful. Okay, so ito. Sa ating mga viewers, ano ang usual symbol ng toilet? Siyempre, ang sagot dyan, ito. But according to studies, a person with dementia will prefer this. Something concrete. Tapos nakita nyo yung contrast. So even if this is the universal symbol for toilet, we have to look at the person that the sign is intended for. So ganyan ang toilet sign. And then sa pagkain, sa tingin ninyo, alin dito ang mas nakakagana sa kumakain? According to studies, sa puti ba, sa dilaw, sa pula? Sa pula, sa the higher the contrast, the better they can see the food. Tapos syempre dapat maliwanag. That will help. And then this one, aling banyo ang pinaka-angkop para sa may demensya? Pipiliin ba natin to kasi mukhang sosyal? Okay, pero actually ang pipiliin daw ay ito. Bakit? Ang toilet nakahiwalay from the background. You can see it clearly. Not like this, parang it all blends. Okay? And then this one. So why am I saying this to you? Sabi, bakit ganon? Caregiver daw pag-uusapan ito. Kasi yung caregiver, you need to be equipped. Kapag ganito ang banyo ng may demensya, nakakagulo lalo. Madali mairite yan. Hindi niya mahanap eh. Parang lahat i-assist siya. Pero pag ganyan, uncluttered, naka-label, the person with dementia can be more independent. It works for the person with dementia. It will work for the caregiver. Tapos you can put signs. Ano ba dito? Dito ang music area o may musical instruments. So make the environment as user-friendly as possible. And then make it personalized for the person with dementia. Kung ang kwarto niya, pare-pareho ang pinto, lagyan mo ng something to personalize. Tapos yung favorite items niya, nakilala niya, yun ang gagamitin. Okay. Nagkakabaliktad yung sinusuot na tsinelas o sapatos. Possibly hindi nakikitang mabuti. Tapos, ang mayroon ng demensya, hindi naman kailangan pinauupo lang siya at walang ginagawa. Kung gusto pa niyang, kung dati masipag siya maglinis, make that a friendly activity for the person. Again, ito, yung pagsiset ng table, pwede sila tumulong. Kung may mahanap kayong placemat na ganito or mag-print kayo, that will be so helpful to help them feel still capable. Tapos ito, auditory optimization. Kamusta ang ingay sa kapaligiran? Baka kaya paulit-ulit ang tanong, hindi kayo magkarinigan o magkaintindihan kasi nahihirapan siyang iproseso yung sinasabi mo. Okay, so in designing activities for somebody with dementia, you assess and understand their needs and preferences. Plan individualized strategies. Hindi pwedeng one size fits all. So you plan it, saan, sinong kasama, for how long, at ano ang purpose. Again, let me remind you, it should not be too stimulating or sobrang understimulated. So going to the mall is a fun experience usually, but it will depend on the person with dementia. Is this all right for the person or too stimulating? Kasi baka nag-production kayo, na nag-effort kayo, tapos naging magagalitin siya. So ito, bringing this person to a special restaurant, might this be overstimulating? Would the person prefer this? Or maybe the person might prefer something like this, planting na lang. O yun na nga, pwede siya mag-clean sa house or mag-color. Kasi baka sabihin nyo, ay mga may edad ayaw yan. But you might be surprised. They might like being reminded of something that they enjoyed as a young person. Or baka they want something like this. Okay, so these were the guides I showed at the start. Okay, COVID safety. So we said nga, it's very basic. Vaccination, mask, distancing, hand washing, ventilation. But look at this. Pag nakamask, may impact rin yan sa may demensya. Kasi ano bang association ng nakamask noong araw? Di ba mga bandido? So parang nagugulat o natatakot yung may demensya. So, paano yan? Imagine nyo kung ganyan pa yung bumisita na ang dami na puro nakamask. Ang sanay nila, nakikita ang buong mukha. Ang hirap magbasa ng damdamin, yung tinatawag nating social cognition, ng damdamin, ng intensyon. Tapos mas mahirap maintindihan yung sinasabi ng nakamask. So, paano? Distansya, outdoor na pagdalaw. So you have to be resourceful. Look at it from the perspective of the person with dementia. So eto na tayo sa caregiver. Kasi yun ang inaasahan ninyo. Providing care for someone with dementia can put one at increased risk for physical and mental health problems. So pwede ka magka-heart disease, depression, stress, even burnout. At the very least, maa-anxious ka, malo-lonely, mapapagod. So this is what to do. I put number 1 as accept the diagnosis. This is a very important step. Madalas yung pasyente hindi tanggap yung diagnosis. Okay? So yung kamag-anak, nakikisabay sa pasyente, mahihirapan din tanggapin. But somebody has to try to be strong. It's a difficult diagnosis to accept. Pero once matanggap mo na, then you can learn more about it. Kasi as you get more informed, like today, listening to this, I hope that you got some tips. And then you have to improve your emotional awareness. May tanong kanina, paano i-manage ang stress? Una, aware ka dapat sa feelings mo. Masaya ka ba? Malungkot ka ba? Yung anxious ka ba, ninenervyos ka ba, like meron din yung gradations, and identify what it is that is causing you to feel what you're feeling. Then plan for your own care bilang caregiver. Makipag-usap ka, all right? And stay active. Kung ano yung alagang binibigay mo dun sa person with dementia, isabay mo na rin yung sarili mo. Kailangan daw maglakad-lakad. Hindi ikaw din maglakad-lakad ka. And then number 7 may seem like a very, make time for fun and relaxation. Sobrang simple. But please take this seriously. Kasi this is part of behavioral activation therapy. That is the term we use as part of cognitive therapy, cognitive and behavior therapy. But simply put, make time for fun and relaxation. So as a caregiver, gumawa ka ng listahan. Ito na yung portion na how to manage your stress. Ano ba yung mga fun sa'yo? Gumawa ka ng lista. Yung nagbibigay sa'yo ng saya, ng pagkakontento. And then, i-categorize mo, alin yung pwede mong gawin habang nag-aalaga at alin yung kailangan mong gawin pag hindi ikaw ang toka mag-alaga. You need to make time for this on a daily basis, a weekly basis. Because studies have shown that if you devote time for fun and relaxation, it adds years to your health. Okay? Kasi kung ano man yung tension, stress na naipon mo, when you have fun and relax, your muscles ease up yung tension, yung blood vessels mo rin, naaalala niya mag-contract ulit, hindi siya maninigas. That's fun and relaxation have a lot of health benefits. Okay, so what did we discuss today? Matching the environment to the competence or capacity of the person you're taking care of. You have to look at the person, the environment. You have to plan your activities well while living with COVID restrictions. And you have to take care of yourself. So these are my references. Thank you very much.
Thank you so
Thank you very
much, Dr. Sandy.
Thank you.
Maganda yung no? Yung visual representation.
No? Parang sabi ko, galing talaga ni Sandy. Parang so easy to understand. And Sandy, look at all the hearts and all the clapping. Galing, nag-uunahan pa kami ni Raymond magpasalamat eh. Sige Raymond, ikaw na. O game.
Thank you so much, Dr. Susie, and also to Dr. De La Fuente. So right now po, we'll ask our panelists to open up their videos in preparation pa for our Q&A session. But before that, let's take a very quick break for a special public service announcement for today.
Aloy, bilisan mo! Dali! Wala!
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate. Nabakunahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yehey!
Sisiw!
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children age 5 to 18. We hope you're able to share this video clip sa inyong mga social media, sa inyong mga networks po, no? At magpasama na po sa Bakuna Center. Before we proceed with our Q&A, we'd like to take this opportunity, also in recognition of the fact na hindi naman po tayo laging may free time, but during those few moments pa, we hope you'll be able to consume our very short videos po that we call SCD Shorts. You could find them if you go to www.youtube.com/TVUPPH. So that you'll be able to get those nuggets of wisdom po very, very quickly from each of the webinars po that we have had from 1 to 103 and then 104 po after this webinar. Dr. Susie?
Thank you very much, Raymond. So I really found both presentations, Sandy and Shelley, so informative, no? And I'm a person who keeps on watching Stop COVID Deaths after. Kasi ang gaganda ng mga presentation nyo. So I was gonna ask, how do you think we can help our frontliners be more equipped? So this is one way. Parang meron kayong presentation and we hope in our small way, TVUP can help disseminate the information. Pero mukhang kulang yung kulang yung information ng ating mga health workers about dementia, particularly in relation to the pandemic. So what are your thoughts on some new programs that we can develop, or ano yung mga pwede nating gawin dahil naging acute itong problema, di ba? Parang dati, okay, nakakalabas na, gano'n. And ngayon, nakikita natin nagfa-fluctuate, no? Minsan pwede lumabas, minsan hindi pwede lumabas. So what's your thinking on how do we better equip our frontliners? Maybe Shell, ikaw muna.
Okay, meron na tayong mga training na ginawa para sa mga community health workers, no? Recently, the DOH, with the help of the Institute on Aging, came up with a training program, training for trainers module, no? That already includes COVID. So how to screen for dementia and how to manage people with COVID. So that's a training program. So definitely that's important, that has to be continually disseminated. Kaya lang syempre, dahil sa COVID, naantala din yung dissemination, di ba, ng training na yan. Of course, when you work in a hospital, especially in the emergency room and in the ICU, we can create pathways, di ba? And pathways are good ways of putting a checklist that the frontliners can do based on guidelines. And pathways can also be monitored as a quality measure, no? Kung nasusunod o hindi. Pero I think many of the things that are necessary, you can only learn through experience. Kasi nakakatakot talaga ang nangyari sa atin sa COVID. And kung hindi mo naiintindihan ng dementia, hindi mo talaga alam ang gagawin mo kung ikaw ay walang kaalaman professionally and at the same time experience in caring for them. So that's why it's important for us to consult, no, seek help from specialists if necessary. Nandiyan naman ang mga geriatricians, psychiatrists, neurologists, and definitely seek help if necessary.
Shell, before I turn over to Sandy, are there any parts of the country or any LGUs or hospitals that are doing better than others? Na kung mga model sites na pwede tayong matuto from them, meron ka bang nakikita?
Wala pa tayong ginawang mga quality, quality parang assessment programs. But in Fit for Frail, we had a health systems part of that research. And we looked at dementia care, healthcare workers, ang distribution ng healthcare workers trained in care for older people with dementia, and yung pagbigay ng gamot sa dementia. Ang napag-alam natin sa Fit for Frail is kulang tayo talaga sa mental health workers, no? Psychology, psychiatrists, of course, physicians trained in care for older people with dementia. Yon ang una nating alam. Pangalawa, yung gamot para sa dementia, hindi talaga siya available. Hindi siya available sa mga hospitals natin, lalong-lalo na sa mga health centers. So, yun at least alam natin yun. Ang mapapagplanuhan natin, once na nagkaroon na ng parang mental health medication assessment program ang ating gobyerno. Napag-alaman din natin na marami naman sa kanila ang merong kahit paano ay programa para matignan ng older people, pero hindi masyadong specific for dementia. So kailangan pa rin throughout the health system ang mga programa na katumbas ng mga sinasabi ko. No?
Thanks, Shelley. Sandy, how about you? What do you think?
I would say yung information dissemination is really critical. Kasi nga, you were saying, paano tutulungan ng frontliners? Unang-una, dapat sila ay matuto para sila ay makatulong din. Number one. Number two, in communities, ang napansin ko varying yung capacity ng community para mag-address ng needs ng aging population. Even pre-pandemic, ang naalala ko na among my patient population, sa Marikina, meron silang parang strong group for geriatrics na parang meron silang parang regular activities. Siyempre nung nag-pandemic, nawala lahat yon. But I'm hoping nga na from the community, mag-form sila ng sarili nilang support groups. Meron akong patient na gumawa sila ng Zoom na mag-aano sila Zumba. Kasi pre-pandemic may Zumba sila eh. So, yung initiative can come from different areas. Yung importante yung availability of information, access to information. So I think that's how we can help in the management of this is to inform as many frontliners kasi sila yung tatakbuhan naman ng lay population.
Oh, kasi Sandy, nakita ko yung mga slides mo, ang ganda, di ba? Parang simple lang, no? Yung sign para sa toilet, yung mga gano'n, those are so simple but they're so powerful, no? So I think there are many good practices we can start using. Raymond, naalala ko noon sa India at sa Denmark, meron silang laughing club. Alam mo yun? Ano yun? It's pre-pandemic, no? Punta kayo sa park, tapos nasa circle kayo. Tapos magtatawanan lang kayo na magtatawanan. No, you just walang nagpapatawa.
Wala nagsasalita, tatawa lang?
Tatawa lang kayo kasi pag may ibang tumatawa, tatawa ka rin, no? That was pre-pandemic, but I think at the level of the community, there are things that can be done maybe in a safe way, like that, like the Laughing Club. Kami in Hawaii, we're developing a gardening program for dementia. So para yung mga may dementia, pwede silang magtanim. Yung tatamnan nila nasa taas ng table. So hindi na nila kailangan yumuko. Pero nagtatanim sila tapos may mga sign. So I think marami tayong magagawa sa level ng community. Anyway, Raymond, over to you. I see so many questions. I saw so many in the chat box. I saw Q&A, pero nawala na.
Some of them have already been answered po.
Sige. Pick up na tayo from the audience.
So, question, and I think this question po kasi is phone-in question with regards to, so obviously, Filipino culture po, predominantly, we want to be able to be the ones to take care of our mga kamag-anak po na may mga dementia or may Alzheimer's. But for those na, let's say, looking for outside help, maybe are there any healthcare facilities daw po? Maybe even homes who take care of such patients here in the Philippines po. Meron po ba? Either Director Shelley or Dr. Sandy po.
Karamihan naman ng mga homes natin ay para talaga sa mga may taong may dementia eh. Many times that is the reason why they end up in nursing homes, no? Or kahit sa DSWD, yung mga home for the aged nila. Kaya sila dinadala ng mga pamilya nila doon dahil mahirap alagaan dahil nga sa dementia, no?
Ma'am Shelley,
so-
are these facilities available parang in the Visayas, Mindanao, yung mga ganun pong lugar?
We had a study on dementia care facilities and long-term care facilities. Meron naman. Sa lahat ng regions meron. Many of them are homes for the aged run by the DSWD, pero hindi siya masyadong para sa dementia lang. At nung tinignan namin yung training ng mga nagbo-volunteer doon at nagtatrabaho doon, kulang talaga ang training nila tungkol sa dementia. Ngayon may mga private nursing homes, depende kung sino ang nagpapalakad. At gusto kong sabihin lang sa inyo dahil hindi siya regulated eh. It's not a regulated industry. So the quality, we cannot assure the quality. But go to a nursing home that is run by a certified geriatrician or psychiatrist or health worker that is trained in geriatrics and gerontology. Kasi madami naman dyan na unfortunately private individuals na gusto lang nila magtayo ng ganyan nursing home na wala naman silang experience or kaalaman. So, yun lang ang masasabi ko. Eventually, I know that DOH and DSWD are looking into parang approving and providing standards. Meron na kasing facility standards for facilities housing older people. Pero kailangan palang i-roll out yon. Pero meron na tayong standards na galing sa DOH. Kailangan mangyari yon, di ba?
Yes, ma'am. Yes, ma'am. Ma'am, is that families who place their mga kamag-anak who has dementia or have been diagnosed with dementia and or Alzheimer's, is it more the exception than the rule, ma'am, or is it more becoming the norm here in the Philippines po?
Dumadami na, pero konti pa lang naman ang ganun.
Okay.
Many of our older people, especially those with dementia, are cared for at home.
At home, okay.
At home pa
Okay.
rin.
Thank you, Ma'am Shelley. And this question comes po from one of our regulars, Maria Cecilia Pulido. Good afternoon. We'll direct this to Dr. Sandy po. No? What measures can our community practice in order to discontinue or maybe stop po the stigma surrounding people with dementia and the guilt trip that society tags the patient's families, ma'am?
Wow, okay. Sorry, nagulat ako doon. Bakit magkaka-guilt trip sa family? So from what you're saying, they're blaming the family for what happens to the patient. So that means hindi nila naiintindihan yung nangyayari. So I think sa mga community, may nag-type nga sa chat na meron namang mga senior association, may mga association per barangay. So I think they can sponsor talks, conversations. The important thing is to start a conversation going to normalize talking about matters like this so that more people can understand. So I think that's the biggest help that we can start with. Para pag napag-usapan kasi, mas maraming makaka-aksyon. So that's what I would say. Thank you.
Thank you po. Dr. Susie? You're on mute, sorry.
Meron akong nakitang question kanina pero nawala. Makakita ko ulit. Ito. Yung breathing difficulty with masks. No, kasi this is really an issue, no, na ayaw nilang mag-mask kasi hindi sila makahinga. So, how do we do this? How do we encourage them? Kasi that's the dilemma, no? We don't want them to be exposed, but we also don't want them to stay home. But to stay outside, they need to wear a mask. So what do you suggest on the masking part? Like something really practical. Baka dapat terno yung mask dun sa damit, gano'n.
Kailangan natin ng mask engineers.
Oo.
Ano yan talaga, may konting claustrophobia siguro, Sandy, how do you call that? May konting anxiety kasi doon di ba? Yung pinesent ni Sandy na parang takot dahil mukhang hindi na niya makilala yung sarili niya pag nakamask siya, di ba? Kung minsan ganun ang mga reasons. Pero yung hindi makahinga, totoo naman it's difficult, no? You just need to get used to it. Unfortunately, siguro yung matanda, dahan-dahanin, pilitin, mag-practice. Mag-practice kayo.
Oo, hindi ako, Shell, kasi my rule was, as long as you're not in front of other people,
oo naman.
Like you're in the park, no, and wala namang malapit sa'yo, tanggalin na yung mask na yan. Kasi nahihirapan talaga Nahihirapan talaga. I mean, again, going back to mode of transmission, right? If you're outdoor, you've got good ventilation. I think you can remove the mask for older persons. I don't know if you're going to disagree with me, but for me, kasi parang I feel like, at some point, we have to be very pragmatic about this. Ngayon, kung nasa lugar na, nasa sasakyan, may ibang tao, nagpunta sa grocery, pumila, talagang may mask yun. Pero kung nasa isang malayong lugar kayo, na wala namang katao-tao, huwag nyo nang pilitin mag-mask. Ewan ko, tama ba yung sinasabi ko?
Tama ka in a way, Susie, pero pag ang tao kasi ay may demensya, hindi talaga naman siguro madali ring alagaan kung ayaw niya mag-mask. So yan ang mga tao na may demensya na baka hindi talaga palalabasin di ba? O doon lang sa garden o sa harap ng bahay, sa may neighborhood lang. Huwag na sigurong lumabas talaga na sasakay pa ng sasakyan at pupunta pa sa mall kung hindi rin makakasunod sa masking. Kasi delikado talaga sa ngayon.
But I think I have a suggestion for that.
Sige, go.
Madaming uri ng mga mask di ba? Merong surgical mask, may KN95, iba-iba yung shape nila. So actually may ibang mask na medyo mas umiikot yung hangin sa loob. So bale, magsusubok ka kung ano yung pwede sa kanya. Tapos meron din papiliin siya kung ano yung bebenta sa kanya. Kasi nga 'di ba, what I was promoting is look at it from the perspective of the person. Siyempre, aaliwin mo rin. Iba-ibang kulay na rin ang mga mask. I mean, nagbiro kayo na eterno sa damit. Why not? Diba? Kasi, mas mabebenta mo yung wearing it if it's like an accessory. Basically, learn the language of the person you're taking care of para mahanap mo yung kiliti. Kasi, as we're all saying, there are areas talaga that require a mask. Pag pwedeng wala, siyempre, wag. But if you really need to wear a mask, try to convince the person in a way na nabebenta sa kanya. And marami naman kasi ang dami nang kinds of mask ngayon di ba?
Siguro parang susukat ka ng blouse. Susukat mo muna, di ba? Fitting, ganyan. So, subukan mo na lang iba-ibang design. But,
naalala ko tuloy yung kaibigan ko
Depende sa lugar.
Napalaki niya yung mga anak niya. Ayaw magpa-tutor ng math. So, ang tanong ganito, anong gusto mo sa tutoring? 4 hours, 2 hours, or 1 hour? Diba? Parang you give a choice. You're giving a choice, but you're already directing, no? Okay, there was another question here, which is very interesting. Raymond, nakita mo yan tungkol sa...
Which one?
Yung prevention na dancing, intellectually active.
Intellectual active. So I'll read the question, Dr. Susie. I don't know if it's a guarantee, but nakakatulong daw po ba being intellectually active and engaged, doing a lot of dancing in your younger years in order to avoid dementia, even if you are genetically predisposed to having the disease?
In your younger years. Yun ang tanong niya, di ba?
Yun yung sabi, in your younger years.
Sana hanggang ngayon, di ba? Yun ang importante. Pero meron naman tayong sinasabi na parang cognitive reserve, di ba? Cognitive reserve. Kung talagang dyan pumapasok talaga yung higher level of education at a certain age, you should have achieved a higher level of education, and that protects your brain because of cognitive reserve. Talaga yung brain mo mas malaki in certain areas, and that can protect you against dementia. Yung exercise naman, pag bata ka pa, nag-exercise ka na, yun naman yung cardiovascular reserve. And we know that, you have to have a healthy heart to protect your brain or mind, di ba? Kasi related yan yung sinabi kong hypertension, diabetes, obesity. So maganda naman, makakatulong naman talaga yun, pero sana ipagpatuloy yan hanggang sa pagtanda.
Yeah, continue
Continue.
dancing, no? Again, going back to my mother, Shell, you saw this, 94 years old, she could play the piano. She could remember everything she knew on the piano. No, nakakalimot siya, pero I think somehow someone was telling me that musical ability does not leave. In fact, yung isang kaibigan ko na na-stroke could not name things, no? Pero kumakanta ng aria in Italian. Diba? Parang pag kinakanta mo lumalabas. So I think the more we all develop different talents, habang tumatanda tayo, yun na, pati ako kasama na ron, we are keeping our brains healthy by doing that, no? So it's not just the intellectual, it's also physical, like dancing, like playing an instrument, singing, and si Doc Shelley, pag narinig nyo yan, talagang mai-inlove kayo pag kumanta. Si Shelley na.
Hindi ba si Tony Bennett? Ito alam naman ng lahat Hindi ba si Lady Gaga at si Tony Bennett gumagawa yan ng mga duet? And then last year, talagang na-diagnose naman talaga si Tony Bennett na severe Alzheimer's disease na siya, di ba? Pero nung pinakanta nila si Tony Bennett, alam na alam pa rin niya yung kanta niya kahit nung araw pa lang walang mali. Pero pag nagsalita siya, yung regular conversation, ayun, medyo nakakalimot na siya. Tignan niyo yung YouTube.
Panoorin ko nga yan.
Panoorin mo, Tony Bennett. With
So cultivate, I think cultivate your interests. Cultivate your interests, cultivate your skills. Kasi habang tumatanda, merong part ng brain na medyo pumapalya na. But there's certain parts of the brain that just go on, they go on, and it's a source of happiness for everyone.
Yes, Susie. Basta konektado sa heart.
Ayan!
Konektado sa heart
Oo, yan.
Hindi lang siya music na minememorize mo, pero ay konektado sa emotions and heart.
Nice. Okay, I think we have one more question, Raymond, but I love this conversation, pero medyo wala na tayong oras. Raymond, one more question, tapos we'll have to go to our quiz.
To our quiz.
Words. Sige.
So the last question here is I think nakita ko na rin po ito sa sa outside of the Zoom. Are there any foods, nutritious foods siguro po, no, na makakatulong po maybe to delay or maiwasan magkaroon po ng demensya? Meron po bang ganoon?
Pakibasa po yung aming toolkit na andyan po siya lahat, no?
Ayun, nandun pala.
Opo. Pero syempre, anything that protects the heart will protect the brain, di ba? Iwasan ng maalat. Pero gulay, syempre, kumain ng maraming green vegetables, yung makukulay ng mga gulay. Ganun din ang isda, no? Iwasan talaga yung matataba. O pwede naman kumain ng may taba minsan, pero iwasan hanggat maaari. Yun ang talagang basic Whatever works, especially if you have food restrictions at mataas ang cholesterol mo, yun, yung madaming iiwasan, di ba? Pero for the general public, damihan yung makukulay na gulay, lalo na yung green leafy vegetables. At tubig, huwag kalimutan ng tubig. Uminom ng madaming tubig.
Director Shelley, when you say the toolkit, it's in healthyaging.ph. Tama po ba?
Yes, naandun siya. Ma-access na natin both English and Filipino. Yung English may link doon sa sa main WHO website, yung Iris Pro, may link kami doon. Pero yung Filipino toolkit, you can actually look at the PDF in the webpage.
Ayun.
Lagyan na natin sa yan. Lagyan na natin sa opening billboard natin.
Correct.
Oo. Maganda. Okay, so thank you very much to our two speakers. Oh my goodness, we could go on and on talking about this, but unfortunately, wala na po tayong time, and we're gonna go to the answers to the fun
Fun
quiz. Oh,
quiz.
Raymond,
Opo.
take it away.
Opo. So, for our first question, alin sa mga sumusunod ang mga maaaring gawin para maiwasan ang demensya? 92% po in the Zoom chose the answer all of the above. Dito naman po sa Slido, I think this is the very first time that I'm seeing this. 100% ng lahat po ng sumagot po sa Slido ay pinili po niya all of the above. So, just to hear it again from our experts, Dr. Shelley, ano po ang tamang sagot for item 1, ma'am?
All of the above ang sagot dyan. Talaga naman, kailangan yan lahat para makaiwas sa demensya.
Ayun. Thank you so much, Ma'am Shelly. And then for question number 2, this is for Dr. Sandy. I'll just read it. Alin sa mga sumusunod ang mga sintomas ng burnout? 71% of our Zoom attendees chose all of the above. Again, 100% na naman for sa ating slido.com respondents ang pumili po dito sa all of the above. So Dr. Sandy, ano po ang kasagutan po dito, ma'am? So second question.
All of the above is correct.
Okay. Thank you. Thank you so much po. And really, that's something po that hopefully yung ating pong mga attendees matatandaan po nila yung mga kasagutan. But before we proceed with the parting words and parting messages po, no, we'd like the audience to answer this 5 questionnaire po na evaluation poll. It's a 4-point Likert scale for each question. Again, na po kaming hiwalay na evaluation poll na inilalabas. Ito lang po iyon. So we hope you'll be able to join in and input your answers po. The questions are as follows. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues, not just COVID-19 po. We won't be closing this evaluation poll just yet as we move on to the final messages from our speakers. Dr. Susie.
Yeah, okay. So we're gonna ask Dr. Sandy to say a few parting words to our audience. Sandy, go ahead.
So this is for persons with dementia, persons taking care of dementia, all persons. Wag, yung nagtanong kasi kanina, okay ba yung dancing? If it makes you happy, do it. As long as you're not harming anyone. Happiness is good for the heart. Sabi ni Doc Shelley, anything that's good for your heart will be good for your mind. Happiness is very good. So do what makes you happy. Thank you very much.
Thank you very much, Sandy. Chair po yan ng Department of Psychiatry and Behavioral Sciences at the Philippine General Hospital, University of the Philippines. Okay, Shelley, over to you.
Okay, thank you very much to our participants and again to TVUP. Tandaan po natin that there is a convergence between healthy aging and dementia prevention. And there is a role that the family and community has to play in order to make this happen. So reduce your risk of heart disease, reduce your risk of diabetes, hypertension, stop smoking, exercise, and be physically and mentally fit. If you do that, you not only reduce your risk of COVID, but you also prevent dementia. But again, the community has to help out by including older persons, people with dementia in their programs and activities. Yun lang po.
Okay, thank you very much. It's Dr. Shelley, who's the director of Institute of Aging and Health at the National Institutes of Health, UP Manila. For our closing remarks, so thank you first to our 2 doctors. Ang galing-galing po
Thank
nila.
you so much, Dr. Shelley and Dr. Sandy. Thank you.
Talagang sinakarinig nila yung presentation dito. Walang nag-appear dito na hindi naghahanda talaga ng napakahusay talaga ng kanilang presentation. Thank you so much. So we are now going to have our closing remarks from none other than the Deputy Director of the Philippine General Hospital, Dr. Stella Marie Legaspi. Stella, over to you.
Good afternoon, everyone. We had a very enlightening webinar, and I personally appreciate all the the words of our speakers. Now, in our synopsis, I just would like you to check on our TVUP webinar. We have a whole set. We have the whole recording of this, and so you can also review what the speakers have mentioned. Now, our first speaker is Dr. SHELLEY de la Vega, who stated that dementia is a general term for loss of memory, language, problem solving, and other thinking abilities. That it is severe enough to interfere with daily life. So that is the general definition. In a Fit for Frail research mental health assessment of 405 patients, 4 out of 10 had mental symptoms. And in another study, in the Corona Dementia Study subgroup analysis by Dr. Michelle Anlacan, this is a multi-center retrospective cohort study involving 10,881 patients. And what they noted was in this adjusted hazard ratio, the in persons with dementia versus patients without dementia, the COVID mortality is significant at 7.25%, and the COVID ICU admissions were 4.37. 4.37. Now, she also mentioned about the long COVID, and in patients with elderly patients, they noted that really a very important result is poor memory in patients who experience long COVID. Now, the risk of dementia after COVID may increase the cognitive impairment, and there's possible acceleration of dementia after a COVID infection. And she stated the different pathways where this can happen: the direct brain infection, vasculopathy, systemic inflammation, autoimmune dysfunction, and other organ damage. That's why the elderly, they should be first to be vaccinated because they are at high risk for all of these. Now, she also mentioned what will happen to a COVID patient with dementia. First, the communication barriers. There will be difficulty in understanding the risk, and also the risk of leaving the house, and difficulty following minimum public health standards. And also, she mentioned that isolation increases the behavioral and psychological symptoms. So they have more fear, anxiety, and depression, which can later result to delirium. And so she promoted healthy living. This was mentioned in her previous webinar, and she reiterated that healthy living is the process of developing and maintaining the functional ability that enables well-being in older persons. Okay, so she also said that life course perspective, there's accumulation of strength, no, and deficits also across their life course. So she mentioned about functional ability, and this is the interactions between the intrinsic and the environmental factors. She mentioned that yung convergence or the relationship of COVID, dementia, and healthy aging. So I'd like to emphasize this part that to decrease the neurological damage, we should minimize diabetes. Okay, so let's tone down on the carbohydrate foods and treat hypertension. Stop smoking if you are still smoking, and reduce your midlife obesity. So these factors will decrease the likelihood of getting dementia if you follow this health advice. No? So how do you care for patients with dementia in the time of COVID? They have a dementia toolkit, and I suggest that we all get this book so that we will be more enlightened, especially regarding dementia. So they have the Demensya Filipino Toolkit, gabay sa tutulong sa komunidad sa pag-asikaso at pag-aalaga sa mga may dementia. And so they have that in detail. And so, what is the home care dementia during the time of COVID? So they have the home. The home care involves vaccination of all elderly patients above 60 years old, safe home environment, so there should be fall prevention, mobility at home, so they should have daily walks, sun exposure. You should have an active mind, so reorientation, having games, photos, socialization is important. So be involved in Facebook, video calls, and of course COVID prevention. So the reminders and cues on hand washing and use of face masks, and also the caregiver support. So, as a in the public health perspective, she emphasized the role of vaccination, pandemic preparedness, the ethics of allocation and access, and healthy aging. So that was the talk of Dr. Shelly de la Vega. Now, for Dr. Evangeline de la Fuente, she mentioned the activities that would stimulate the mind of a patient with dementia. So she said to keep a sense of structure and familiarity. So the patients want to see familiar faces and familiar environment. You should involve them in daily activities, vary activities to stimulate the senses, spend time indoors, and plan visitors and social events. You know, I have an aunt who is 99 years old, and I think she is the epitome of healthy living, of healthy aging. I asked her, how come you're still very active, and what is your secret? And she answered, she plays mahjong. Okay, so maybe that's her way of coping with aging. And so, from the psychiatrist's point of view, the behavioral and psychological symptoms of dementia are agitation, aggression, psychosis, depression, apathy, and repetitive questioning, and sleep problems. Sleep problems are common for them. So, if you look at her slide again, she had this picture, the side view of the tree, which is carved out in the face of a man. Okay, and there's a green, a yellow, and a red tree. So just the picture itself, it shows that like in the red, the leaves are almost gone. You know? So that is the symbol of distress. No, so you should have prevention of distress and promotion of well-being. So she mentioned that what are the considerations in care? So the persons with dementia, you have to check the environment, the activities, provide safety against a COVID-19, and also a good caregiver. So in one of her slides, she said the patient said, look at all of me. So that means from top to bottom. So the cognition, the life story and personality, emotional and physical well-being, activity and environment, and relationships. I think one of the factors which really would boost the patient with dementia is having her family around her. So putting her in isolation or in a home would not be such a good idea, because the family would be the one who really support the patient with dementia. So the changes in sensory perception are the patient will have vision changes with age. Also, the hearing can change in older patients. So you have to keep on repeating what you're saying. The taste and smell can change, so they may have different. They want different flavors of food, and also the peripheral sensation changes. So there are many changes in our body once we age. So, for example, in vision, the vision problem, so they will have problems with depth perception, with spatial disorientation, difficulty of judging colors, and difficulty judging contrast. So for aging persons, I think they should not drive anymore, because the red and green and yellow, they might get mistaken, and they might get car accidents. Okay, so now what are the environmental interventions? You can improve food intake during meals, improve communication, support the develop meaningful relationships. So go back to your elementary classmates, high school classmates, and college friends, and so this will this will motivate you to have a healthy aging and improve. Of course, it can improve your hygienic practices and improve mood. Okay, so there are many lessons that we will learn from this webinar, and as all of us know, all of us will age someday, and learning about this is really very important to all of us. Thank you. Back to you, Susie.
Thank you so much, Stella. I don't know how Stella meant to be family. Grabe, ang galing. Thank you so much, Stella, for that very concise and nahuli niya yung main points, no? Now, Raymond, ano ba? We didn't do the evaluation.
We did an evaluation, but we want to be able to see ilan po ang sumagot. Only 68%.
Okay. Go.
Only 68% pa lang po of our attendees ang nakasagot. Hindi ko alam kung may mga hahabol, but hopefully sana po may mga humabol. So at least 94%, if I'm reading this correctly, of our attendees, or at least our evaluation poll respondents chose strongly agree. So marami po talaga silang natutunan at natuwa po sila sa webinar na ito. So Dr. Susie, our sneak peek.
Okay, so next week, nice topic, no? So, June is Kidney Month. And we're gonna have two experts from the National Kidney Institute who are going to talk about how effective are vaccinations for the immunocompromised. Kasi, ito ngayon pinupuntahan na natin yung mga details, no? Kasi, sabihin na, sige, lahat ng mga immunocompromised, baka hindi kailangan mabakunahan yan. But I'm sure you are meeting people who are immunocompromised who have questions. Let's say nagda-dialysis sila. Let's say they're being treated for cancer. They want to know if they can be vaccinated. So there are some new studies coming out of the National Kidney Institute. Pag-uusapan natin yan, yung pagbabakuna ng mga immunocompromised. So don't miss it. It's going to be a very very interesting topic with new data coming out of the National Kidney Institute. So see you next Friday for that topic. Raymond, over to you.
Thank you, Dr. Susie. Before we conclude our program po, we'd like to first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content week in and week out. Marami po talagang unsung heroes dito po sa ating production team. So maraming salamat din po. And then finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. So you just open your browser, or kung meron po kayong YouTube app, you go to tvup.ph to be able to see all 103 webinars. And then thereafter, pagkatapos po ng webinar na ito, magiging 104 webinars na po ang nandoon. So this formally closes po our webinar for this week. Sana po marami po kayong natutunan tungkol po sa demensya sa topic po natin sa ngayong araw na ito. At makita-kita po tayo again. We look forward to your company next Friday. So it's a date.
Together we can stop COVID deaths.
Keep safe, keep healthy, and see you online.